Hello, good afternoon, everybody. I'm going to introduce you to something which is very important. It is about the management of digital medical data, and especially talking about the sterilization. So sterilization is a problem in managing a dental clinic or an hospital or a medical entity, because by law, it is required to use sterile instruments. So we all agree on that. When we are going to work on a patient, we need to work on some kind of specifically sterile instruments. We agree on that. I mean, it's very clear and very simple that we need to follow this. But the second point, which is much more important, is that also by law, it is required to bring the proof of sterilization. So let's say a patient is getting an infection. I had the case recently with one of my friends who had an aesthetic surgery, and she had a huge infection after the surgery. So she's been putting the case in front of the judge, and she's been saying that the instruments were not clean, were not sterile. And this is because of that they had this infection. So the judge is asking, do you have the proof that the instruments you've been using are sterile? So what does that mean? Where do you find this proof? You need to find this proof in a tracking, and there is a process to start from the very beginning to the end and to track the proof of the sterilization. Based on this, we all agree that sterilization control is done in a correct way at the level of the sterilizer. So this is almost every time under good control. What does this mean? This means that you have a sterilizer and the sterilizer is working in a good way. And every year you give the sterilizer to a company which is going to validate the pressure, the temperature, and the time. And this will allow to work on the sterilizer in a good way, and it will be confirmed that the sterilizer is working well. You can do that every year on the sterilizer. It's fine to do like this. What you can do also is to use some special instruments. We're going to talk about that, some kind of probes that will show you in the morning or once a week or once a day that your sterilizer is working in a good way. You can also do that. So I'm not going in deep into this process, but we know how to define that a sterilizer is working well or is not working well. What we need and what is really not under control today in all the clinics, all the offices, all the hospitals where we've been, we see that the sterilization tracking is not done at the level of the patient. And this is a proof that we need to give. We don't need to say that only the sterilizer is working. We need to say that we've been working with sterile instruments at the end on the patient. And also there is an issue, it's about the expiry date on pouches. So expiry date on sterile pouches are missing. Why? Because today there is no official answer to how long a sterile pouch will stay sterile. So this will come from the Ministry of Health, and we will be able to work in conformity with the local medical authorities. And this is the objective of that, to give you the tools to work in conformity with the local authorities' decisions. So now We have a lot of publications. I have been writing two articles, one in 2015, another one in 2015 also. So this one's done since a long time, and we know that there are several articles talking about that. So knowing all that, we need to use the right tools to decide how we can bring the proof of sterility to the patient, who is the end user. So for that, you can use a pen, you can write things, but it's the old way to do. What I would like to introduce is the barcode. The barcode is a system when you go to Carrefour and you put what you've been buying in front of the lady who is taking care of that. She will read a barcode. On a barcode like this, you will be able to read up to 10 to 13 characters. But what we need to implement is much more than that. So instead of working with barcodes, we work now with QR codes. What is a QR code? QR code means quick response code. You know that now. You have big one, you have small one, and in a barcode like this, you can implement up to 7,000 numerical characters or more than 4,000 alphanumerical characters. This means that you can implement much more details than what you can transfer on a simple QR code. And we decided to use that and to implement that into a program which is called E-MedicalManager for the sterilization. So you don't have to do anything, all is implemented inside the program, and I'm going to give you an example of what we can do. On the left side, I have been writing bonjour. On the right side, it gives me a QR code, which means bonjour. If I change the text, instead of bonjour, I write bonjour. How are you today? On the left side. And this will make a new code which is looking like this. So this is bonjour, how are you today? And this is bonjour. You see the difference? Look at the QR code, bonjour, how are you today? Okay. And if you scan the QR code itself, from the scanning of the QR code, you will get the text. So this was used to work at the origin on the spare parts of cars. But we are using that extensively in medicine and in our program, not only to check the sterilization tracking, but also the expiry date of the supplies and many, many other things. So this is the new way to use information and to transfer information in an easy way. So this is an introduction to the QR code. In this way, when I have something to note what it is, this vial, for example, I scan it and I don't need to write the reference number, the lot number, the manufacturer, the vendor, and all that. This is all implemented in the QR code that they are giving to you. And you can work on all the inventory like this, but also on the pouches, the sterile pouches, as I am going to show to you. Can we avoid that? No, we cannot avoid that. We cannot avoid that because if we want to work in conformity with the local medical authorities, and this is in Dubai, the Dubai Health Authority, 2001, these are the guidelines for infection control in dentistry. So we've been going through this document, and what we've been finding is this. You need to label all the packages. So this means that packaging something like an instrument for extractions, making a package and using it like this is not working in conformity with DHA. We need to label the package. So this is not accepted. All the packages must be completely and correctly labeled. So we're going to see in details what they intend by completely and correctly labels. So like this is one of my drawers. All my instruments are labeled in such a way. So we need to work on this way. Second, what we have from DHA, labels should identify the operator. The operator is the personal responsible personnel, LOD assistant in that case. So we identify the operator. We need to identify the sterilizer. The sterilizer in our case is Tutonaire 2340M. So we need to follow what they ask. The responsible personnel, the sterilizer. Then they need to identify the cycle number. The cycle number is something that you will find from the sterilizer / the load number. So this is the reference number that we have here. It is edited one by one for each different cycle. The date of processing. The date of processing is here. The load, we have not only the load number, but we have the details of the load. Basic kit, dentistry, surgery, root canal, anything. So you know the charge also. And you know the cycle, which is in this case 134 for 18 minutes with 3 bar. This is the prion cycle that we call, okay? So we have all the needed information, including one which is the expiry date. The expiry date will come here, is the validity. So the validity, we will talk in details about that, but the validity is come here. So all this information, so more than DHA is asking today, we have it implemented in the system. But more than that, it's good to have all this. But what are you going to do with this? You need to transfer the information, transfer all the details of what you have here using a QR code. So when you scan the QR code, when you scan this, you will get the name of the personal assistant, the sterilizer, the cycle, the charge, the date, the validity, and the reference. So it's very important to translate this information into a language that we can use and in such a way that we can track the sterilization process. What do they ask? They ask that the label using a marking pen containing non-toxic permanent ink or use of customized sterilization labels. So this is what we do. We've been selecting this printer to print these 5 by 2.5 labels. All of them are the same. And in our system, we don't label not only the sterilization things, but also the instrument we are using, the vials, everything can be done in the same way. So we use only one and a unique printer for the labels. And these are the labels we can edit. So we are working in conformity with the DHA. Let's go a step further. A step further, the pill pouches should be labeled only on the plastic side or on an autoclave tape. So we put the label on the plastic side, not on the back side. Doing that, we can avoid making mistake. Was the main mistake? The main mistake is number 5, and this is written in DHA. It's not our system. It's on DHA today that they ask for this. Labeling should not damage the packaging material. Never use a ballpoint pen or any packaging material, as it can create holes in the material. When we do that, when we write something on the other side, like the expired date, we are fully not working in conformity with DHA. Not only we are working on the back side, the paper side, but we don't give the full information that is needed. So don't worry about that you're doing. It's wrong if you work on this side. So forget about doing that. So I have been starting from the DHA requirements, and now I'm going to go along with you on how we can work from the sterilizer to the patient. So I come again to this. It is medical legally needed to provide the proof of sterilization from the sterilizer to the pouch and to the patient. What sterilization cycle is good one to use? So there are several cycles of sterilization, and you have them which are almost already implemented when you buy a Lisa or Tutoner or any kind of sterilizer. So you can sterilize at 144 degrees for 3 minutes 30, or you can make a short one at 121 for 15 minutes. We try to avoid doing that. But what we do and what we like to do is to work using a prion cycle. This is the prion cycle. The prion cycle is at 134 degrees for 18 minutes or more at 3 bar. So not only you have the temperature, but you have the pressure, okay? So all this is automatically available in all Class B sterilizer. When you buy a sterilizer, buy a Class B sterilizer because you have the pressure which is included in the temperature and the time. So you have 4 things. You have 4 things to which are determining if your instruments are sterile or not sterile. The first one is the temperature. You need to reach the temperature of 134 degrees. The second one is the time. You need to work on a time which will be 18 minutes. The other one is the pressure. You need to work at 3 bar. And then there is a 4th one. What is the 4th one? Even if we have the 3 one, it's not enough. We need to have a 4 one. The 4th one is that your pouches must be dry at the end of the sterilization cycle. If it's not dry, if your instruments are in pouches which are wet, you need to restart a new sterilization cycle. So be careful about that. When a user, a responsible personnel, like an assistant, is doing the sterilization, she must know that if the pouches are wet, she needs to start a new sterilization cycle. What I would like to add is if you are using the labels, don't put the labels on the pouches before sterilizing, because they are going to become all dark, all black, and you will see nothing. So the time to place the labels is at the end and after the sterilization is done, not before. Let's go to the next. The next is this. You need to prove that your sterilizer is working well. For that, we use tests. Basically, and to make it very simple for you, we have 2 tests. The Bowie-Dick test, which is testing and good for porous objects. It's a series of papers like this. You have maybe 20 sheets of paper like this. They are blue at the beginning, and when you finish the sterilization, the color is changing. Changing the color is proving that you've been able to reach this temperature. It's not about the time. It's not about the pressure. It's about only the color. The other one is the LX system. The LX system is by far the best to use validity of a sterilization cycle. You have some markers here. You unscrew the top, you put a marker, and you have this long tube, which is here. You put that in the sterilizer, and if at the end of the cycle, the marker is changing its color, it means that the sterilization has been done in a good way. So the helix system, if the helix system is positive, the Bowie-Dick is by default accepted, not the contrary. So the helix is showing a higher level of sterilization than the Bowie-Dick. You have to know that. So when you want to test your sterilizer, don't use the Bowie-Dick. By default, use the helix system. So now let's talk about the validity of the sterilization. In Europe, I've been writing here, in Europe, it's not in the UAE, it's in Europe. For the instruments which are packed in one pouch like this, the sterilization is valid for 30 days. If you put one pouch over another pouch, you are using two pouches together, the sterilization is valid for 60 days. We've been looking around here and there, and we didn't find any rule for sterilization validity in UAE. So we can consider that it might be valid for 6 months, 1 month, 1 year, nobody knows. So right now it's empty, but we will have the information because the Ministry of Health is working on that, and they are going to say here the validity of one pouch, sterile one pouch is, let's say, 30 days, 60 days, 180 days. The validity of pouches is different based on the storage of the pouches. If the pouches are stored outside of the operating room in a closed closet where all the instruments are separate one from the other, okay, the validity may be increased to 1 year. But if your instruments are all together stored in the same drawer, in the same operating room where you work, then the validity will decrease. So the way to use the envelope, to make the sterilization, and to store the sterile instruments may induce a different kind of validity time. So this needs to be decided case by case for each of you in a real way. The solution is to use pouches which are labeled. And knowing that we have that on the label, we can track the tracking of the pouches and know where we are and how to do. Of course, I'm going to explain that to you. If you don't do that, and if you just say, okay, we've been making sterilization, I put my instruments there with pouch or without pouch, how do you want to know if your pouch are expired or not expired if you don't have a way to do it in a digital way? It's very difficult because we are managing hundreds and hundreds of instruments and pouches. So we need to have a way to track these hundreds of instruments which are packed in one way or another. So this is why we are working in a digital way. In a digital way, we have the solution like this. I show you some highlight, but after we will go into details. On this is the list of the pouches we have. And you see that when the background of the pouches is becoming red, it means that the pouches are expired. So it's very simple. You can track them. You can know where they are. And knowing that, you will be able to find very easily where are your pouches. So some of you, maybe all of us, we use type 4 strips. These type 4 strips, like this one, we put them in the pouch and we put the pouch in the sterilization cycle. At the end, the color on this type 4 strip is changing, and it's dark now, and this means that what? The temperature has been able to reach 121 degrees to 134 degrees. This is showing what? That you've been able to reach this temperature. Remember what I said to you. There are 4 things to show that it's sterile. It is the temperature, it is the time, it is the pressure, and it is the dryness. In this case, this is only showing you that you've been increasing the temperature up to 134 degrees. It is not showing that it is sterile, but it is an indication. So I agree that this indication is enough, but in 100 cases of time, what's happening? These type of strips are sent to trash. We delete them. We lose the tracking, which is the only thing that we can link to the patient. We throw that away. So once again, we are not in conformity with local medical authorities because we cannot show the proof of sterilization for this particular surgery or this particular patient. And this is what we need to solve. So what do we need? We need few instruments. It's very easy. We need few instruments. We need the 2D scanner, which is a kind of scanner like this. And this we find everywhere. It's very simple. And what we need to use also is a printer. We've been selecting a printer, which is quite cost effective, printing all that in a good way and working well. It's called a Zebra ZD220. And we need the program. So the program is not limited to sterilization. The program is huge, but I'm talking today only on the sterilization tool. So in our everyday practice, we have a lot of things that we do. We can communicate by WhatsApp, we can work on the inventory, we can make orders, we can control orders, make payment, send orders to the lab, make a lot of things. We are only going to talk about sterilization. So we click there, and on sterilization, you see 2 things, the sterilization management and the purchase management. So we are going to start with the sterilization management. This is the sterilization management. When I add a new sterilization cycle, I have the date, which is coming by default, but I can change it if I want. I have the sterilization program. So my program is this one. I call it also the standard program, which is the prion program. The responsible personnel in that case is Lou, assistant. And the practitioner is Philippe Tardieu, myself. The sterilizer is the two-toner 2340M. And now we go to something interesting. The sterilization details. What is this? This is coming from the sterilizer. On all the sterilizer, all of them today, you have a USB key that you can plug in before starting the sterilization cycle. And in this USB key, what you will get information about the ongoing cycles. In this case, the USB key that we use is called Transcend, and every sterilization process will edit a file like this, .sav or PDF, whatever it is. We will be able to link it to our sterilization process. We link this, and we see that we have the model, the cycle, and this is the cycle counter. Inside the sterilizer, you have a counter which is counting all the sterilizations. And the counter will give you what you need for the sterilization counter, the link in between E-MedicalManager and the sterilizer. One sterilizer can be used for different dentists, let's say. So, or you will have different sterilizer in the same clinic. So this will be automatically implemented coming from this USB key to our program. And in our case, we are interested in linking all the details like the temperature, the bar. As you see here, you have the time, you have the temperature, and you have the pressure. Okay, and this will show that the sterilization started at that time. And at the end, you will have sterilization is positive. This means that we've been going through the whole system. So we keep that. This is very important information, and we keep it where? We keep it in the sterilization details here. No need to store here and there and to print and to have binders and to give all these things. It's all digital. We work now paperless. We work paperless. So we need to have the tools to work paperless because we don't need to print all these things. EMS sterilization cycle is edited by the program itself. You have the date and you have the #1. This is the first sterilization cycle of the day. And the sterilization cycle, this is the sterilization cycle number that we've been able to find in this PDF file, which is the sterilization cycle file edited in the Transcend USB key that we've been placing on the sterilizer before starting the sterilization. So that these things are going to gather together information from the sterilization, the sterilizer, and what you've been doing, you with the pouches. And here we are going to go down to the pouches. So we've been sterilizing 15 pouches. So you write 15. These are basic kit, and we consider that the validity will be done for 180 days. Of course, you have a drop-down menu. You can change the validated sterilization, and you can select whatever kind of sterilization start you want. Let's say implant, surgery, root canal, rotary instruments, whatever you want to do, you can select here. And the number is the number of pouches you need to print. So the next step is to print. And you print, you save, and you print all that. So you have all these labels which are printed. And the good thing, which is important, and this is different from any other software in the world. The reference is showing the date, you remember, #1 and /1. This is the number 1 pouch. The /2 will be the number 2 pouch. /3 will be the number 3 pouch. So you identify all pouches separately. You not only identify that you have in all sterilizer, the sterilizer cycle number, which is important, but you go to the pouch and you sterilize, and you can track all the different pouches because each of them has a different number, and we are going to see together why it's important to do it like this. So now all my instruments are stored together. All my instruments are identified, and I can find them when I use them. I'm going to show you how. So let's see, we've been working on the sterilization management with information coming from the sterilizer, printing for all the pouches, and now we are going to work on pouches management. The pouches management, you have a list of all the pouches there, okay? So all the pouches are displayed here. And on top, you have a QR code, so you can find which pouch you've been using. And if it's impossible to read, you have something which is called the reference, and we can type the reference and find it, even if the QR code is not easy to read. So after using the pouches, all your pouches are open. You store them in one place, and you are going to link them to a surgery, let's say. How can we do that? All the empty pouches like this, they have this QR code. We scan the QR code, and scanning the QR code, we find where and which pouches we are working on. So we have the QR code. And when we have a list of pouches, we can delete the selected pouches. So this means that we will not find them again. When a pouch is used, we can delete them. So now you know how to edit a pouch, edit the labels, select the used pouches. But what can we do when we select pouches? We have two options today. We can select and delete, first of all, but this will not be linked. So if you see a patient, you make an examination, and you use just one pouch, you are not going to link with sterile instruments. It's not needed. But when you are doing an implant surgery, you need to link because you are going into the tissue, okay? In this case, you need to link that to the surgery, and for that, we have a product, a tool which is called the basket. And we will have another option after. I will show it to you. So the basket is what? I am going to open a new basket, and in the basket you can load items which are used and pouches. Okay, to explain about items, it's all the items we've been using. We've been using one implant, we've been using 6 pair of gloves, we've been using gauzes, we've been using anesthesia, we've been using things like that, okay? So you can select items, or you can select pouches. So here you write the intervention title, let's say implant surgery, the name of the patient, the date of the surgery, and who's been doing it. And you will save based on your search. The search for pouches is on top. QR code. So you click here, you scan, and you will have the list of your pouches, which is going to come automatically. If there is one that you cannot read, you go to reference, you type the reference, and you will find it automatically again. So when all these are selected, they come like ticked on the box here. So you have this one pouch, and you have all the details of the pouch here. As you see, all the detail is there. In the reference, you have the date and the pouch, and all this is there, and you can save the basket. Saving the basket is just showing that you've been using these instruments sterilized on this sterilizer at this date by this responsible personnel following this process and all going to this patient and this surgery. So now you are working in conformity with local medical authorities. You are showing to the judge that, yes, I have been using these sterile pouches for this patient, this day and this surgery. Okay? So now the work is done, and you are linking the basket to all that. So how can you link then? You can export the basket. So in this case, we have the intervention, implant placement, the date, the patient's name, the practitioner, and you have the items we've been using, all the items. You could even have the price you buy for the items, and you have all the reference of the pouches, basic kit, implant kit used for that with the reference of the sterilization. And this is very easy to find because you have the tracing from A to Z. Okay, so this is a PDF that you can export, and if you work in a patient management software, you can link that to this, or you can keep it in E-MedicalManager, and you can make a search by patients or by date, and you will find what kind of pouches you've been using for that. The full tracking is done from the sterilizer to the patient in the basket. But there is another way to do, and I'm going to show you this different way that we have. In this case, I am working on my patient management software, which is called Dental Via, and I have an implant here. I am going to show you in real after that. So on my implant, I know that I have been doing one implant here, okay? So if I click on that, I can add comments or I can add the traceability. The traceability, of course, will be in that case, the reference of the implant. I just scan the QR code, which is on the box that I have been using where I have the implant. This QR code, the traceability of the implant will come here. But I'm not talking about that today. I'm talking about the pouches. And for the pouches, it's exactly the same. I am going to scan the empty pouches, and scanning the empty pouches, I will add all the pouches which have been able to use for this case. So for this implant case, I have been using all these pouches and I have been placing this implant. I just need to tick on that to scan and I have the reference of the implant. All is tracked. All is tracked now from the patient software, management software. And you see here, there is one thing that we call the traceability. And in the traceability, we have all the details of the pouches and of the tools, of the supplies that we've been using for this case. So now you have the proof, now you know how to do. The full tracking is done from the sterilizer to the patient, and this is done also in the patient management software, not only in the basket. So let me show you in real what it is looking like. So I open E-MedicalManager. I log in. So to log in, you log in very easily because it's in memory. And you go to this page, which is the everyday practice page. You go on sterilization. So I click on sterilization. I click on sterilization management. And here we have all the list of the sterilization cycles that we've been doing. So we can search by date, we can search by practitioner, we can search by responsible personnel, we can search by sterilizer, the Lisa, the two-toner, this is the one we use at the clinic. We can search with the E-medical sterilizer cycle, the number which is coming from the sterilizer, the sterilization cycle, the program, if we've been doing a prion or a very fast one, and from one date to another date. So we can add a new, I'm going to show you how we do, add new. So by default, the next settings will be done by default. So you don't need to tick again and again and again. By default, if you use the same sterilizer program, we use all time the same, the prior one, it is displayed here. If you want to change, you can change it. But by default, you will get the one used, which will be displayed. The responsible personnel, you can change it also, or you can keep by default the last one. The practitioner is the same. The sterilizer is the same. We can use the Lisa or the two-toner. Let's say we use the Lisa. The sterilization details. What is this? I said to you, we have that coming from the USB key of the sterilizer. We choose that, okay, and we find it here. I tick that, and I have this coming here. We will work on that later. The EMM sterilization cycle. So this is the number. This is the number with the date. You see the date here. #4 is the fourth sterilization of the date. And then we will get /1, the push number 1, /2, the push number 2, /3, the push number 3. So each push will be numbered independently. The sterilization cycle number coming from the sterilizer will come from what is coming from the sterilizer. So I open it for you, and you see that the current cycle was 00090. So you have the time, the temperature, the bar. We have all the detail of the sterilization, and the sterilization was done in a positive way. So we know what it is, we know how it's working. So I click on this. We have more information about the sterilizer, like the responsible personnel and the practitioner, that we don't have in the LISA software. But we have that in our system because it is to work in conformity with the local medical authorities. So this is why we do that. So the cycle will be 000900. And this is coming from what we find in the PDF file. So what do we have in the sterilization cycle? Let's say we have 3 basic kits, and I consider that it's not 30 days, it's not 60 days, it's not 1 year, it is 6 months, based on the way I can manage all that. So I save, or I save and print. So I'm going to save and print. And what I print, I will print. I have something like this. So I show you that. These are the labels I'm going to print, and this is including all the details. So once again, the first label will be number 1, the second will be number 2, the third will be number 3. So this label is unique and only for one pouch. You cannot make a mistake on that. So let's save. It's saving, and when it's saving, we go. We have that, and we can always come back to the sterilization cycles that we've been doing. It's added to the list. So let me go to pouches management now. So on the empty pouches, on the pouches sterilized already, we are going to put the labels. You remember, we stick the labels on the pouches, and now we are going to look for them. So you don't look at me, but now I am going to scan. I have the scanner by default, which is on the QR code here. So I am going to scan 1. I am going to scan 2. I am going to scan 3. Okay, all these have been used. Okay, so 1, it has been falling underwater, and I cannot really read the QR code, so I will go to the reference number. It is exactly the same at Carrefour. In some cases, they go in front of the scan, but it's not scanning well. So what do? They just type. They type the reference number. This is exactly what you are going to do. You are going to type the reference number. So let's see, I'm going to type this number. I copy and paste to go faster. I have this number. I make a search, and I find it. Here it is. Okay? So I have been able to find that. So the other one that I have been finding here have been already identified and used. So I cannot scan the same 2 times. I can scan only 1 time. So this is a protection for you, and this will allow you not to scan the same number 2 times. So in that case, I've been finding this one, and I can add as many as I want. I am in the pouches. When this is done, I can say, okay, these pouches have been used, and I can delete them. So I go and I delete the pouches. I delete all of them. They are deleted. When I delete them, they are not linked to a patient. Okay? You lose the link to the patient. The way you can link to the patient is to work with the basket. So you go to the basket, and I am going to show you 1 implant placement, Alan Roy. I'm not going to edit another one, but we can use this one. You have the items here. We have been selecting this. Let's say we place another implant. Okay. We go to the pouches also. Do you want to save changes? Yes. I go to the pouches and I do the same. I take the reference and I click on the reference. Okay. Number 4. I search, and if I can find it, okay, if it's been lost, it's been lost. By memory, maybe I can find another one. Yes, this one, and I link this one to this pouch to that. I save the basket. Do you want to delete the basket? So now they are telling something. Do you want to delete this pouch from the list of all the pouches as long as you've been linking it already to this basket? So I can say, yes, it will be deleted on this side, but it will be kept on the basket. Or I say, no, I want to keep it on the other side. I don't know for what reason, but most of the time I will say, yes, I want to delete it from the list. And now if I want to print that, I can print it. I can, of course, print it in a real way or save it as PDF. I save as PDF. I save it as PDF. And this is the PDF. And you have all the implants. We've been placing 3 implants. And the practitioner references that. And you have here all the pouches we've been using. And that you can make, you can export or import that into your patient management software. So let's go to the patient management software. Here it is. I have been treating this patient, Arshad Alam. I have been placing this day 1 implant, and I can go here. Okay, wait, I go too fast for you. In this, I can select that. I don't make a link. I will select that, and I will link the PDF in this file to the patient. Linking that to the patient to this day, I know what is the tracking from the sterilizer to the patient. Okay, this is very clear. We have that up to this. So we have 2 options now. The first option is to go to the basket. The second option is to go to the patient management software. We are on the way to edit a new up-to-date patient management software, and it will come in several months, and all this will be implemented directly, not only separate like this, but all implemented, because now we understand that the future is based on the online and on the network and on the paperless. So we go in this direction, and all our developments are done in the same way in E-MedicalManager, in Access Guide, in Accudent. All this is done to make a useful tool to manage, to get the right information, and to work in conformity with local medical authorities. So let me finish on this. We need to understand that avoiding tracking sterilization is not working in conformity with local medical authorities. I tell it again. So this means that if my instruments are not labeled in my drawers, I am not working in conformity with DHA. If my instruments are labeled, or I have the date written at the back with a pen, I am not working in conformity with DHA also. So we should stop doing that. We should go to the next step. Of course, you can invent product, but we have one which is working very well. We are using that every day, and it's available, and it's very cheap to work like this. And not only you will be able to work on the sterilization, but on many other systems. So we are proud, and we are not going to stop. We have developed E-MedicalManager as the most comprehensive medical management program. If you have any request, please just go to Arshad Khan on ANPA Medical, and he will help you if you want more information on that. We believe that by the end of the year, within few months now, we will have to do this for all medical hospitals, clinics, and all that. This will be imposed by the authorities. Now they just say, work in conformity with us, but very soon it will be imposed. I thank you for your attention, And from time to time, we will bring you more information about the software we are working on. Thank you for that. See you soon.